So in 2012, after graduating from my women's health residency at Duke University, I wrote the first iteration of my comprehensive course in breast cancer. And at the time, even 10 years ago, the research was very scant. I try to update it every year, and I've taught it around the world. And last year, I launched it online so that I could reach more rehab and medical providers throughout the globe. I also create resources for clinicians and patients to promote comprehensive breast cancer care. This safe exercise screening tool with an analysis is just one of them. It's a free 29-page PDF, and you can get it from my website at yourcorept.com. So let's go over the 4 pages that you can actually give to your patient that will help us screen for underlying dysfunction and mitigate risk of harm with exercise. And if you'd like to learn how to prevent and treat all of the side effects we mentioned above, I'll tell you a little bit more about my course, Breast Cancer Rehabilitation, Comprehensive Evaluation and Treatment, at the end of this presentation. So these are the first 2 of the 4 pages that I give to my patients to fill out. The most effective form of exercise will depend upon your patient's risk assessment profile and their personal factors as well. So you can see on the left page here, we're asking them about their birth date and age, the type and stage of breast cancer that they had, their height and their weight. We're going to talk about BMI in a moment and why that's important to calculate. It asks about their medications, and it also asks about their activity level prior to treatment, during and after treatment, what motivates them to exercise, and what their activity or exercise goals are. Then on the right side, you can see here it goes over their past medical history. This is the 3rd and the 4th pages of that assessment. Here we get into breast cancer treatment specifics from when their initial surgery was, if they went through reconstruction, if they had radiotherapy. The B is beginning, the E is the end dates, what kind of chemotherapy they had, and hormone therapy, when those started and ended. And I also get the name of the overseeing physician. It took me about 2 weeks to simplify all of these side effects from chemotherapy, targeted therapy, and hormone therapy. So I hope this serves as a useful, quick reference for you in the clinic. It's important to note, though, that the tables available in this screening tool show potential risk, but it does not mean imminent risk. There's a spot on this form, remember those 4 pages that I showed you at the beginning, where you can calculate BMI. A higher BMI in postmenopausal breast cancer patients can increase risk of breast cancer reoccurrence. However, maintaining a healthy weight can be more difficult to manage after menopause. Also, consider someone's past medical history and their endocrine function. Diseases such as diabetes and thyroid dysfunction can make it harder to manage weight. And we know that these anti-neoplastic agents are quite powerful, and they can affect the heart. And I just want you to have this quick analysis so that you can see what kind of drug they're on and just dart across and say, okay, they could be Taxotere. They could be at increased risk for lymphedema, for some pain or myalgias, for some heart dysfunction, and maybe even some peripheral neuropathy. So that's how these work.